Welcome to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in a century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I am Dr. Richard Pan. I'm a physician with a background in public health, and I'm proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County in the California State Senate. I want to share with you important information and stories to help each other during this difficult time. 1 in 5 Americans experience mental illness, and this number will likely rise with COVID-19. On this podcast, we will be talking about the impact of COVID-19 on people already experiencing mental health or substance use issues. I am pleased to be joined by Dr. Shannon Suo. Dr. Suo is both a family physician and psychiatrist. She is director of the Family Medicine Psychiatry Residency Program and a health science clinical professor at UC Davis. She also serves as vice chair of the California Psychiatric Association COVID-19 Task Force. Thank you so much for joining me today, Dr. Suo.
It's a pleasure to join you. Thank you.
So as a psychiatrist, what are your biggest concerns for people with existing mental health issues during this time?
I am really worried about our patients with existing mental health conditions. I really want to make sure they're getting care. People experiencing homelessness are some of society's most vulnerable in terms of COVID, in terms of mortality, but they're in the worst position to obtain up-to-date information and resources. Things like shelters and soup kitchens are having to close or limit services, and they're not able to access health care. Psychiatry and therapy offices are having to convert to telehealth. Not all of them have been able to do that immediately. So some patients or clients have gotten the message incorrectly that their clinics are closed or unable to see them because one of their early appointments got canceled. I'm also worried about their financial wellness. If they were working, most of them would not be essential workers, and so they've lost their jobs. And if they're spending too much time at home with idle time, that can lead some to relapse with drugs or alcohol that had previous sobriety.
Wow. And one of my constituents did ask about the role of medication. So many people may be on medication for mental health issues. So are there adjustments that need to be made to medications? Or are there impacts of medications on this circumstance with COVID-19?
Sure. It's important to remember the role of medications. There are very effective medication treatments for mental illness that cause what we would describe as moderate to severe impairment. But when conditions are more mild or mild to moderate or expected to be temporary, we may not use medications. We may advise talk therapy or lifestyle modifications. There are lots of medications that can worsen mental illness. Some examples of that are pill forms of steroids, sometimes blood pressure medicines, or medications that affect hormone levels if they're not monitored appropriately. And if people aren't able to go to the lab for their regular blood tests or go to their doctor's office to get the tests done, then things may get a little bit off kilter. Of course, drugs and alcohol, even marijuana, can worsen or cause mental health conditions. It's important to note that anxiety has been associated with marijuana use, even in people who didn't previously have anxiety, and there does seem to be a correlation of the development of schizophrenia in people who use marijuana in their teens, even if they've used marijuana less than 10 times in their teens. And kids and young adults under the age of 25 are the most susceptible to the effects of marijuana on mood, psychosis, and cognition or intelligence. With regard to adjusting the medication, I think it's going to depend on what are the reasons why maybe their condition has gotten worse or it seems like the medication isn't working. Is this just an expected reaction to stress? Because, as I mentioned in our previous podcast, it's expected that people are going to feel anxious about uncertainty and crisis in the world, and that's an expected reaction. We wouldn't expect people to feel okay about it. So is the anxiety so overwhelming that it's impairing people's ability to get things done, or is it an expected reaction to something that's stressful? So I would tend to wait a little bit and provide more support to somebody if it's an expected reaction versus adjusting the medication if it seems like it's going on longer than would be expected or is impairing their function.
So you touched on marijuana. What is the impact of this COVID-19 situation on substance use?
So there's no direct impact of the virus on substance use, but people who use substances are more likely to have chronic health conditions that make the virus more dangerous to their lives. They're also at higher risk for being incarcerated, experiencing homelessness, or having limited access to health care. People who are in medication-assisted treatment, like buprenorphine or methadone programs, are having difficulty getting to their programs to get their daily medication that helps them to stay off of drugs. And they have to increase their exposure to contracting the virus each time they have to leave the house. So if there's more idle time, there's increased stress, then again, we can have this increased risk of relapses or increased new use of substances.
And so what can family and friends do to help people with existing mental health and or substance abuse issues? So they're, let's say you're in the same household, but they may be in a different household and they're checking in on them. So what are some of the things that people can do to help support and help out their friends or family members who have a mental health or substance use issue?
I think it's essential to stay checked in with them. Whether, as you said, they're in the same household or having to make more of an effort, making sure there's regular check-ins, making sure that they're staying clean and sober or taking medications that they're supposed to take, getting to see or talk to their psychiatric provider or getting the regular therapy that they have been. I know that AA groups in Sacramento are still going on a limited basis with physical distancing, and there are online support groups that might be an option. It's important for people who are caregivers and loved ones to acknowledge that this is a stressful time for them, too. If a person with mental illness that's been well controlled for a long time suddenly experiences a worsening of symptoms or new symptoms, that's important to be monitoring and to check in with the individual about how they're feeling, how the family member is feeling, and making sure that managing those two things isn't becoming overwhelming for the family member. But if the symptoms look like they're getting in the way of doing things that somebody needs to do or wants to do, then they should be seeking additional help. You don't need to turn every bad feeling into a sign that their illness needs more medicine, because people with depression are allowed to and should feel sad when they suffer a loss. So people should think about how they would feel under the same circumstances. And if the reaction seems out of proportion to the situation, then that's when they would think about having them get more help through their either existing mental health provider or maybe through their primary care provider.
And so how can people access professional help during this time with stay-at-home orders? You talked about they may have an existing relationship with a therapist or a psychiatrist, but as you mentioned, we're doing maybe telehealth or other types of things, and then or maybe they don't have health insurance and they may have lost contact or don't have an existing provider. So what are some of the things people can do to access professional help or get their friends or family members professional help?
Sure. Well, the hotlines and warm lines are still available, and then because you're staying at home, you can spend all day calling offices to find somebody who's able to take a new patient. People with insurance can call the number that's usually on the back of the insurance card that's specifically for behavioral health. Or if you're a Medi-Cal recipient or Medicare, you can call Sacramento County Access. That number is 916-875-1055. Most mental health providers are able to provide video visits and sometimes even phone visits. There's a free website, if I'm allowed to mention it, psychologytoday.com, that has listings of therapists that people can search to find professionals who take their insurance and maybe work with a specific type of therapy or on specific illnesses. But people should be prepared that they may have to call and leave a lot of messages before they hear back. Unfortunately, that's been the state of mental health care for a while, even before the pandemic. But it may be easier to get care without leaving your home now, because more people have been able to do telehealth because of the restrictions that have been waived by the federal government with regard to how we deliver that kind of care.
Well, that's certainly very important, and it's important that people are able to get the help they need. Earlier this April, 2 Sacramento teens took their own lives, and so people are concerned about are we increasing the risk of suicide with the stay-at-home orders and the fact that we have people being laid off, kids not being able to go to school, and so forth, and what should people do to look for risks of suicide, and how can they help people who they're concerned about?
That's a super important question. So suicide is always a tragedy, and suicide of a child is even worse. Survivors are the ones who experience the aftermath of suicide, and they're often left feeling guilty, and maybe more so now because they think, gosh, we spent all this time together and I should have recognized what was going on. It's important to note that primary care providers historically have seen the majority of people who take their own lives within 30 days of the person's suicide. So people miss warning signs all the time. They shouldn't beat themselves up about that, but there are certainly things that we can kind of be more in tune to. Mm-hmm. Teen suicide in particular is a little bit unique. It's much more likely to be very, very impulsive. So you should be watching for behavior changes in teens, sudden withdrawal from family, friends, and severe mood swings, big changes in sleep or activity patterns. Certainly if you suspect that your teen is now using substances where they weren't before, those are warning signs. It's important, if I can mention firearms for a second, it's important to make sure that firearms are locked up, and not only locked up because you should just assume that kids know how to get into the gun locker. They know where the key is or they know what the password is, even though you think that they don't. Kids are pretty creative and a lot smarter than we give them credit for.
They're very observant.
Yeah. So the firearms not only need to be locked up, but they need to be unloaded. The ammo needs to be stored separately and locked up separately. And then trigger locks have been shown to decrease both intentional and unintentional firearm injuries in kids. And trigger locks are cheap. So the more time that you can put in the way between a kid and a gun, the safer they will be. And of course, guns are the most lethal form of or method for suicide. Making sure that drugs, alcohol, medicines are stored safely, again, locked up or preferably not in the house when the kids are there alone. And in terms of getting help for anybody, call 911. If you can't keep someone safe and they're threatening themselves, call 911. The paramedics will come. They'll take them to an emergency room and get them evaluated. If you're not quite at that point, but you're worried, seek professional help. The commercial insurance doesn't typically need a referral. Kids with Medi-Cal can get evaluated by Child Access or the phone. That's 916-875-9980, and they can be authorized for services. And the mental health care that I direct can also help to point people in the right direction or have them come in for an assessment. And so people can always call our clinic if they're not sure what to do. That number is 916-520-2460. And we're actually open 7 days a week. For teen suicides in particular, it can occur in clusters. So if someone in your community or your child's school has committed suicide, it's important to be that much more watchful in your own child.
Mm-hmm. Well, that's certainly very important to remind people that, particularly when you're talking about teens, obviously, many people are at risk for suicide, potentially, but for teens, it generally is an impulsive act, and so not giving them the opportunity to do something impulsively that would be lethal would be very important, and I think that's the message around the firearms, because that is the most lethal means by which someone could try to hurt themselves or kill themselves, and so that basically making that more difficult makes it less likely that the teen would actually be able to actually kill themselves. So they versus an attempt where we might be able to save them, and I think that's certainly something very important. But also, we need to again connect with each other and support each other, right?
Mm-hmm. Yeah, and I'd say the medications are the second most lethal means that are available to teens or kids right now. We do see and hear a fair amount about teenagers cutting, which has been an interesting kind of phenomenon to watch over the last few years. These are not always suicide attempts, though. Mm-hmm. And so it's important to talk with your teen about what the intent is behind cutting. Not that cutting is ever an okay thing, but there's certainly some behaviors that are more dangerous than others. And any cutting is probably a sign that you ought to be seeking more help, but finding out what the intent is behind the cutting, because it's not always with an intent to end one's life. Mm.
So another situation that is tragic about what's happening now with COVID-19 is that people are getting very sick. They're ending up in the ICU. People are dying from this disease, but they're dying alone because we're trying to limit the spread. And the usual rituals we might engage in with someone's illness or death, so funerals and memorial services may not take place or be very limited because of the need to to physically distance and not have large gatherings. So how can we help grieving family members? We can't engage in the usual rituals. They can't be at the bedside, perhaps when their loved one was ill or when they pass away. What are some of the things that you would suggest that families could do if such an unfortunate thing happened to help support each other?
Yeah. So technology has broadened our world in ways that were never possible in other catastrophes that we've encountered. So while it's not the same, and you can't give someone a hug over a video call or a phone, we can be anywhere in the world that has cell or internet service, which is something we've never been able to do before. Excuse me. But you might be able to ask someone who is there and part of the family unit to give the person a hug for you or to hug each other on your behalf. Maybe you can talk about what you'll do once you can be there physically with the family. The classic sending over or bringing a casserole over, you can send a meal via a gig service. That's something that's possible. It's not quite the same as a homemade or something special that you make, but it still has some benefit and some meaning. I talked last time, I think, about writing letters. Writing a letter that describes your feelings or your memories of the person who died. That's something that the family will probably really treasure. And if you're not a letter writer, at least send an email and keep checking in. I think even in the pre-COVID world, we moved on a lot of times after a service and stopped reaching out to family. But without the ability to return to regular routine, grief may become a little more prolonged for people. So continuing to check in and continuing to think about the family, picking up the phone, sending another email, checking in and seeing if there's anything they need, that's going to be important. And there are online funeral services going on now. There are these high-tech solutions to isolation, but I suspect that once this is over, while some of that will remain, that we're largely going to return back to the experience and rituals to be in person, because there is something about grief that people want that physical connectedness. And so it'll happen, and it's important to acknowledge and let people know what your intents are and to follow through with them for once you are able to be physically present with people.
Okay. And then finally, we have our essential workers. So we often talk about people being holed up at home, but there are people who can't be holed up at home whether they wish to or not because they're essential workers. They're doing the work that is necessary to be sure that our society continues running, that we have something to eat, that food and other important items show up in the places they need to be. And then we have the health professionals who are on the front lines, and they're taking care of patients, being perhaps the only actual direct human connection that some of these patients may have because, unfortunately, their family and friends need to be at a distance and not be able to go to the hospital. But yet at the same time, they're, at risk as well because they're on the front lines. They're being exposed. And they're also worried when they go home to their families. And in fact, many of them have opted to perhaps have other living arrangements where they're only communicating with their families over, let's say, the internet or other means. So they're also missing that communication as well with their own families. So they're worried about their patients, they're worried about themselves, and then they're worried about their families. And so what are some of the things that advice you would give to our essential workers and health professionals as they're trying to basically, I mean, I guess they're coming at them from all sides, right?
Mm-hmm. Yeah. So I will credit Peter Yellowlease, the Chief Wellness Officer for UC Davis, who is my guru on this. I'll be channeling him, I think, in answering much of this question. For us, he sends out emails several times a week to keep our spirits up, give us pearls of wisdom to maintain our wellness. Because it's important to recognize that this pandemic is at times a sprint, but it's really a marathon. So we have a ways to go, unfortunately, especially the healthcare community. Hopefully, the rest of the country, the economy, will be opening up sooner. But the healthcare workers, yes, we are on the front lines, and I know so many people who are worried about what they're going to do if they get infected. They're trying to make contingency plans for keeping their families safe. I want to acknowledge the state of California for offering discounted hotel rooms for healthcare workers to use if they're working on call and need to be quarantined or can't self-isolate from their family. And I also want to note that these hotel rooms are distinct from the ones being offered to the vulnerable population of people experiencing homelessness, so we're not detracting from that. But, healthcare professionals are sometimes the worst patients. So I think my advice for healthcare professionals and anybody who's still out there working and stressed about the fact that they're working and exposing themselves is the basics. You eat well, you get plenty of sleep and exercise, you avoid excessive alcohol, and maybe more importantly right now more than ever is to give yourself a break. Taking a moment to find something to be grateful for each day, and then taking another moment to do something totally indulgent. It's important to recognize we need even just 5 minutes of just something completely different from what we're supposed to be doing or have to be doing. It's important that everybody, especially those of us that are interacting a lot with people physically, are wearing our PPE and our masks in public. And then asking for help. I think healthcare professionals are also really bad about this. Asking for help when you need it, whether it's like asking somebody to get you a coffee or taking over care for a patient, and by the same token, offering help when you can to somebody else who needs a break. Remembering we're a team in this. The healthcare providers and the public are a team. Together, we've really flattened the curve. I've been so impressed with the statistics that I've seen coming out of our state, and the fact that we are the most populated state in the country, and we've been able to really flatten this curve out for California. So I hope that our leaders in research and government can come up with some more solutions for us, because certainly I don't have all the answers, but I also trust that our community is going to continue to work together to keep each other safe and healthy.
Well, thank you very much, Dr. Suo, for joining me today. I, too, want to recognize and thank all the essential workers, the people on the front lines, helping us live out our lives and continuing to move forward and taking care of us. So thank you so much for listening to this episode of Putting the Public into Health by Dr. Richard Pan. If you have questions or ideas for a future podcast, please email them to senator.pan@senate.ca.gov. Please stay at home as much as possible. Stay at least 6 feet away from others outside. Wash your hands frequently and try not to touch your face. Together, we are slowing the spread of the disease and saving lives. Thank you so much for listening.